Perfect, and we are on. Dr. Lumniczky, thank you very much for joining me. So you are part of the project IMAGEOMICS. I hope I'm pronouncing it correctly. Could you please introduce us your project?
Thank you very much for this kind invitation and for the opportunity that I can present the IMAGEOMICS project. So IMAGEOMICS project was awarded during the first call of the Pianoforte, first open call of the Pianoforte project. IMAGEOMICS is the acronym and the full title of the project is Optimizing Benefit-Risk Ratio in Breast Cancer Diagnosis and Radiotherapy, Identifying Molecular, Cellular, and Imaging Signatures of Breast Cancer Heterogeneity to Improve Personalized Therapeutic Strategies for Synergistic Treatment Combinations. So this is a project focusing on breast cancer models. And the project combines various aspects, both in the diagnosis, how to improve imaging in this field, and to improve the diagnostic efficacy of breast cancer in our case, but this is going to be a model that could be extrapolated to other imaging of other diseases as well. And the other part of the project focuses on how radiation, and specifically radiotherapy, can be combined with other novel treatment opportunities within cancer treatments, such as immunotherapy, and how we can exploit to the benefits of the patients these two modalities, one widely applied, radiotherapy, the other one which is going to be widely applied, hopefully in the future, so it's a future prospect. Now, the problem and the solutions proposed by IMAGEOMICS are two-sided. First, we all face the problem that ionizing radiation doses by the general population are increasing due to the medical diagnostic interventions. And this raises questions both from the radiation protection community and also from the medical community. And the aim of both communities is to improve diagnostic and treatment efficacy. From the radiation protection community field, obviously this is the aim to decrease doses delivered to patients by developing or finding ways to develop more efficient diagnostic procedures, which could lead obviously to improved therapy decisions. From the medical community, there are raising questions, as I already mentioned to you, how to maximize treatment efficacy by maximizing synergy between different treatment modalities. In our case, we propose to explore opportunities to maximize this synergy between radiotherapy and immunotherapy, opening the possibility for novel combined radioimmunotherapeutic protocols. All these together, both from the radiation protection field and from the medical field, hopefully will lead to a decreased doses delivered to the patients, both in terms of using decreased both in terms of using methods for diagnosis that apply lower doses to the patients or in a more optimized way, and also in making better treatment decisions from the therapeutic field, where we can sort of better use radiotherapy and the combination of radiotherapy and immunotherapy, all these leading to decreased doses. Why did IMAGEOMICS focus on breast cancer? There are so many tumor models, and this was a decision, first of all, because breast cancer currently is the most frequent tumor among women, but the second most frequent tumor altogether. So it's a very acute both public health concern, but also a problem in within oncology. Nevertheless, breast cancer is very heterogeneous. So there are very many breast cancer types that respond differently both to radiotherapy, but also to other therapeutic modalities. So this model opens the possibility to explore these combined modalities to find those, to explore the histologic and molecular differences between the different breast cancer types and to optimize which are those which respond the best to these combined therapeutic modalities. And obviously we also had a practical aspect because breast cancer is so frequent within the population. It is also quite well studied. So there are available models, both in vitro models and also animal models, and also clinical trials, and human material is easier to get access to. So in this way, using this model, we had the possibility to build up a graded approach of our experimental setup to start from cell lines, 2D cell lines, explore their phenotype and their response to radiation, then to increase the level of complexity using 3D models, making co-cultures, see how these cancer cells respond when they are together with other cells that are present in the real life in the tumor, such as immune cells, such as other fibroblasts or other cells within the tissue microenvironment, then increase the level and see in murine models how radiation impacts the various breast cancer models having different immune phenotypes, and then to go to patients and to explore certain markers that were identified in vitro in patients. And the highest level of our project is to integrate all these data found from experimental cell line and animal models and from patients, and also take a look at the literature and build a protocol on how best radiotherapy can be combined with immunotherapy, and also to explore the epidemiology of this problem. So the main objectives of the projects are, first, just to summarize, to investigate how radiotherapy influences immunogenic heterogeneity of breast cancer cells of different molecular subtypes using in vitro and in vivo approaches, to test the applicability of novel diagnostic imaging modalities such as X-ray fluorescence computed tomography, to investigate the differences in the molecular subtypes using imaging. And this will be explored in 3D models and also in human organoids. To identify local and systemic signatures that predict patient benefit from the combined treatment, radiotherapy and immunotherapy. And as I told you, to integrate all these data retrieved from experimental models and human studies with epidemiological data to build up a protocol for optimal patient stratification.
Oh, thank you very much for your answer. Can you describe your consortium and explain how you engaged and selected partners?
Well, when we selected our partners, we had the idea what we would like to do, and we were thinking on partners whose competence are in line with our ideas. We discussed informally And obviously then we also had to respect the core conditions, so to find the partners in a way to fulfill the core conditions. So we had a long, well, we knew well our colleagues from Magdeburg, from University, Otto von Guericke University from Magdeburg, and that they are interested in these novel imaging protocols. They were also very much interested in breast cancer. This was sort of a surprise when we started to discuss and what kind of tumor model to choose. Then sort of instantaneously we both said breast cancer. So this was immediately from the first moment something that we agreed on, because we both suggested independently of each other breast cancer. So this was a start. And then as the ideas started to emerge that we want to make a graded approach and to reach out to patients, then we looked for our colleagues from University of Pavia, who we knew previously that they have this kind of expertise and they have access to patients, and they also are interested in immunotherapy. So this was something that was very convenient and professionally very optimal. So we contacted them and they were really open and very happy to contribute. And since we wanted to explore at an epidemiological level, we contacted our colleagues from IS Global who are experts in this field. And so we said if someone can do that, for sure they can. They were open for that. And so this is how the core consortium, the four scientific partners came together. And obviously then there were these requirements from Pianoforte that those who are not beneficiaries, we have to include as administrative partners the beneficiaries as well. And this is how Enea as the beneficiary for University of Pavia, Euramed as the beneficiary from part of Magdeburg, and CMAT for IS Global came and they joined as administrative partners. And currently this consortium works very well. All our partners are really always very active and responding to any kind of possibility to present the project, to go forward. And our day-by-day work also works very well. We have exchanges of biological material, of discussions, and common posters, presentations, and so on. So I think it's a successful, hopefully it will be in the future as well, but up to now I think our collaboration works really well.
Excellent, thank you. You already mentioned goals and your strategy within your project, so I'll ask you slightly differently. What key results do you expect from the project, and how do you foresee these outcomes impacting the EU community?
Well, the results come from the objectives, so we have to fulfill the objectives, and then the results will have to answer these objectives. Nevertheless, performing all the objectives proposed within the project, we expect that our project will contribute to certain key impact topics that are a priority both for the Pianoforte project, but also for the European community. So we expect that our project will contribute to the development of personalized medicine techniques and approaches, And in this way, we will be able to improve therapeutic efficiency. As I told you before, we will perform investigations to advance this personalized medicine and therapy individualization, and to be able to suggest optimal protocols. We will also identify, or we propose to identify markers based on which these protocols can be elaborated. We will provide data on a better understanding on the heterogeneity of the breast cancer, both intratumoral and intertumoral heterogeneity. I mean, how heterogeneous is a tumor itself, and how heterogeneous is the same tumor type between different individuals. By exploring these novel imaging techniques such as X-ray fluorescence computed tomography, this will really help in improving diagnostic efficiency. This is a modified protocol where, using radiographic imaging or sort of a computed tomography, we will be able to detect at molecular level the heterogeneity of the tumor, which is a very innovative approach, and will be sort of, well, at a later time, not by the end of the project, of course, but we will do the first steps. We will help in making these kind of biopsies not invasive methods, because sort of an imaging biopsy will be, you can imagine it, that by imaging you see different heterogeneity within the tumor, that currently you are getting these results by biopsy and making these slides and histology of the tumors. We will improve radiation protection of patients, of course, because all these objectives finally lead to a reduction in patient doses, and that is a key objective for Pianoforte and for this partnership as well. So we will be able to exploit our results in the field of radiation protection, as I detailed you previously, in radiation oncology. They will benefit from that because they will get some clues how radiotherapy can be combined in immunotherapy. For theranostic approaches, because this X-ray fluorescent imaging using nanoparticles will explore this side of oncology as well. And of course, the whole general public and the public health sector will benefit of the results of the project, because by decreasing doses delivered by imaging modalities, this will have a public health impact, lowering population doses received from medical interventions. And obviously for the oncological cancer patient community, because they will get sort of more diversified therapeutic options, which will improve the success of their therapy.
Thank you. Last question. Although, again, you sort of mentioned it. Anyway, your project has been running for about a year, if I'm not mistaken. What would you highlight as the most significant achievement so far?
Well, you see, this project, 1 year might look long, but might not look so long as well. So when you start from a project from the start, so you started. It's not that you build on an already existing project. You have to fix several key issues before getting the results. So it's kind of a logarithmic way of achieving the results. At the beginning, things seem very plain, and then they start to emerge. Nevertheless, we did very many experiments so far, but to just make it didactic way, we completed several milestones already. We received the ethical approval for human experiments. The ethical approval for the murine experiments are ongoing, and we expect to receive it by September, and then we can start with the animal experiments, but human trials already could commence. As I told you, we want to explore a large set of breast cancer cells with different profiles. These are more than 17 cell lines. All these cell lines were procured, were established, and were tested, and we started the experiments to see how their phenotype changes after radiation. Work package 4 identified the key databases that can be used to retrieve from the literature currently available biomarkers, and basically what are those databases which can procure data on previous trials using combined radiotherapy, because I told you our aim is to set a protocol. For this you have to know what kind of trials are ongoing, and you have to identify all those databases that you can use for this. So this has been done, and they started work on analyzing all the data that can be retrieved from these databases. A major aim is also to set up organ-on-a-chip models, and the methodology to this was already established. It was also a key milestone which was achieved. This was done by our colleagues from Magdeburg. And also at clinical level, I told you that we want to extrapolate in vitro data on patient models, and they will do sort of single cell analysis of the tumors from patients. So they set up the methodology for the spatial transcriptomics. This is a very complicated methodology, and they started with the first analysis. So we are within the work is in the middle. We are having very many preliminary data already. We also completed, well, by the end of August, we have to complete 2 deliverables. One was the data management plan that was done last year. The other one is on fixing the methodology for X-ray fluorescence computed tomography. This will be delivered by the end of the month. In terms of dissemination, we had and we are having presentations in the form of posters and presentations, which are joint efforts. Either all partners contribute to these or certain partners. So we had currently in September there will be several meetings where IMAGEOMICS will present part or all of its data. At the ISORAD meeting, where our colleagues from Barcelona will present our data in the form of a poster. We will have a poster next week in Brussels in the frame of European Radiation Research Society, where I will present a poster about some interesting results related to IMAGEOMICS. And then at the end of September, there will be the European Radiation Protection Week, where we will have 2 presentations from our side, but the other partners will also have presentations focusing now not IMAGEOMICS as a whole, but individual results of the partners. And a very important issue was that we proposed to have 2 training courses financed by Pianoforte, and one of them was already completed this June. This was organized by the university, by colleagues from Pavia, but every consortium partner participated by having presentations in this training course, and the topic or the title of this training course was Models in Biomedical Physics and Radiation Protection Research. It was a 40 hours course focusing on standard in vitro cell cultures, organoids and 3D tissue replicas, including bioprinting, microfluidics applications and organ-on-a-chip systems, in vivo murine models and population studies, clinical trials and radiation epidemiology, all these within the context of breast cancer. So in this way, we completed already one of our main promise to have 2 training courses. And the next one will be probably organized jointly with another project also financed funded by Pianoforte, and it will be probably next year. So this is where we are now, and we still have some time, and hopefully we will complete what we promised to do.
Yes. Thank you very much for your answers and introducing your project. It was enlightening, and I'm very grateful you could join me.